Hi everybody, I prepared a video series to express my knowledge what we need nowadays under a novel virus attack. In the near future, I believe that the scientists will definitely find a solution to treat this disease as vaccine or medicines to destroy the viruses. So until that time, we need some time to be stronger. In this video, I will summarize the importance of vitamin D. We might be infected with this novel virus sooner or later, so it's better to wait in the strong immune system. Firstly, this video is produced for layman persons. In other words, this video will be jargon free and not intended to give any kind of information for healthcare staff. I should emphasize that vitamin D does not mean that it is the best solution in treating diseases, especially in this kind of virus disease. However, it is one of the important pillars of our human body that we should keep in mind, because we cannot survive without vitamin D, and it covers nearly 20% of our genes of our body. If any person has a kind of chronic diseases, for example, if you are suffering from sugar, high blood pressure, or cardiovascular diseases, of course it's always important to keep these diseases under control by the help of healthcare providers. This should be kept in mind every time. When we come to the point of vitamin D, of course there are many words and types of vitamin D, like vitamin D2, vitamin D3, ergocalciferol, cholecalciferol, hydroxycalciferol, dehydroxycalciferol. But now in this video I will forget everything and I will tell it as just one vitamin D. So just know vitamin D, that's all. Because in order not to confuse the listeners, we must speak just one word as vitamin D. As a note, if anybody has a question about the normal value of the vitamin D in our blood, it is around 30 nanogram per milliliter. The unit is important because sometimes as physicians or as laboratories we can use nanomole or other units. So in this video I am going to use nanogram per milliliter, and it is around 30. Why I am saying 30? Because below 30 it is insufficient, less than 20 it is severe, and we need more and more. No need to check every time these vitamin D levels. Unfortunately, in the world, all over the world, we have a problem. This is the insufficiency of vitamin D levels in our body. And I will tell you later what the main reasons are behind of this vitamin D deficiency. If we go back nearly a century ago, in 1922, Dr. McCallum and his friends announced a new kind of vitamin. It's called vitamin D. And at that time, they were treating rickets or any kind of bone diseases with this vitamin D. They gave the name D because it was after the sea. And in 21st century, now we know that nearly every cell of our body has receptors for vitamin D, indicating that vitamin D has much more potent role for this vitamin D than previously recognized. And as you see now, vitamin D is now recognized not only for importance on bone health, but also for immune health. If we look at vitamin D and if we ask how we can get it, actually, of course, vitamin D is naturally present in some foods, but the range is very small. For example, some oily fish, egg, and if you are lucky, some fortified dairy products have vitamin D. But the most importantly, the most valuable one is that vitamin D is also produced or made endogenously in our skin. And if we look at the food, the best food is some types of fish, for example, salmon or sardines. But however, in order to reach required blood levels, as an example, we should eat at least 300 or 400 grams of fish every day. As you see, it's not practical to eat these volumes to get just one vitamin. Now here we are speaking about vitamin D, but it's a vitamin and we cannot eat every day 400 grams or even we cannot find it. And as a data, as an information, I can tell you that dietary vitamin D typically comprises only 10% of our circulating levels of vitamin D. The good thing is that we have a wonderful factory, our skin, because the vitamin D is synthesized by our body after exposure to ultraviolet radiation. Of course, I don't want to speak about the different types of UV radiation as UVA-B or other things, but I will tell you that we are very lucky under sunlight, under valuable circumstances, we can produce it. In addition to seasonal variations, there are many other factors that can affect prevalence of vitamin D deficiency. These can be summarized as region where you are living and latitude, sometimes diet or any kind of supplemental use, clothing, obesity, as usual smoking, and sometimes some concerns about sun damage. And in the last maybe 3 centuries, we have another problem, the nature of built environment. We are living inside of the buildings, inside of the towers, inside of the plazas, so we have problem. As a major source of vitamin for most humans come from exposure of the skin to sunlight, and the best timing period is around 10 a.m. till 3 p.m. Of course, it depends on your location. For example, if you look at where you are living, you will see UV index, and in a few minutes later we will talk on it. If we are going to summarize what happens when a person is exposed to UV radiation, let's say a slight thickness to the skin in 24 hours after exposure, the amount of vitamin D is produced and it is equivalent to ingesting between 10 to 25,000 units, international units. It is very important. Nowadays, you can reach via your weather applications in smartphones, as we always use it. You can check your UV index in your location. If the UV index in your location is between 3 to 7, you are ready to produce your own vitamin D. Practically, I would like to say that if the UV index is around 3, you can get enough vitamin D production even in 30 minutes. But if UV index is around 6, you can get enough vitamin D production in 15 minutes. Unfortunately, more than 7, of course, can produce vitamin D, but it has some side effects as skin cancer. So if your UV index is more than 7, be careful, stay less time, and maybe you can use another time to get real vitamin D UV index. So please check your UV index at your region. The best way is using your smartphone. And please be aware that, I know that you also know that, but please be aware that there should not be anything between your skin and the sunlight. Even window glass can block the UV, ultraviolet radiation. So there must be nothing between you and the sunlight. When you are getting sunlight, please at least open your arms and head. If possible, you can expose upper body and legs to the sunlight to get faster vitamin D production. If there is a cloud in your region, no worries, because the literature or evidences are mentioning that even in the complete cloud, you can have some kind of UV radiation or UV energy. But of course, it's decreased by 50%. Even in shade, for example, like severe pollution, it can, although it can reduce by 60%, you can get the UV light. In this video, I don't want to give any advice on oral vitamin D preparation dosage, but later I will talk on it because you must need more than prescribed to you. And of course, I will speak with literature support. Last words: to get your power every day from the sunlight in order to have powerful immune system. So we are lucky we can get sunlight, produce our vitamin D, and be ready for the microbes, especially nowadays for the novel virus.